my name is Veronica and I'm going to be your nurse for today. I'm going to be conducting a head-to-toe assessment. Can I please have your first and last name? Awesome. And your date of birth? Okay, and do you have any allergies? Okay, I'm going to go ahead and just check your wristband to confirm that. Perfect, it all matches. Okay, I'm going to go ahead and do hand hygiene for 30 seconds and provide the patient with privacy. So, like I said, I'm going to go ahead and do a head-to-toe assessment, starting with your head, ending with your toes, and anything that I find abnormal, I will let the doctor know. Now, do you know where you're currently at? At the hospital. Yes. Do you know why you're at the hospital? Shortness of breath. Okay. Okay. So the patient is alert and oriented, and they are able to understand my questions and provide me with answers. And I'm also using a normal voice, so they are not hard of hearing. I'm going to go ahead and start the assessment by inspecting your head, okay? So I'm looking for bumps and looking for your hair distribution, any infestation. Your head looks good. Now I'm going to go ahead and move to your ears and check for drainage. Ears look good. Now your face looks symmetrical, your skin is intact, and skin color is according to your ethnicity. I'm going to go ahead and check your eyes as well. Okay, pink and moist. Can you go ahead and just follow my pen? Okay. And go ahead and look at my pen line. Pupils are reactive. Perfect. Okay, go ahead and tilt your head back. I'm going to go ahead and check your nose for any drainage. No drainage. There's no facial drooling anywhere, not coming from the nose. Go ahead and open your mouth. I will go ahead and inspect the gums and your oral cavities. Tongue is pink and moist. Gums are also pink and moist. There's no foul odor. Perfect. Okay, you can go ahead and close your mouth. I'm going to go now and inspect your neck. I am palpating. I'm going to check the carotid one side at a time. Okay, there is no head or neck abnormalities. Can you go ahead and I want to test your neck strength. Go ahead and nod yes, up and down. And then go ahead and look left and right. Okay, perfect. I'm going to go ahead now and do your shoulders. I'm going to inspect and palpate at the same time. Now I'm going to move down to your arms and do a quick range of motion exercise. So can you go out and in circles, please? Now put your arms up, put your arms down, put your arms towards each other. Okay, pull against me, push against me. Okay, I'm checking the radial pulse is strong +3. Patient's trigger. And I'm going to check the capillary refill. Perfect. Less than 3 seconds. Okay. Now I'm going to go ahead and check your thorax and abdomen. At this point, I'm going to listen to your heart sounds and also breath and also lung sounds. I'm sorry. So I'm going to start by checking your heart sounds. And I'm going to go through the aortic, pulmonic, Earth's point, tricuspid, and in the fifth, mid-clavicular is the mitral. Now I'm going to go ahead and check for lung sounds. Just take deep breaths, please. Okay. Your lung sounds do sound clear. Are you still feeling short of breath right now? Okay, you just had a breathing treatment, so you're okay. Okay. We're definitely going to continue checking your oxygen. I'm going to go ahead and move to your abdomen. I'm going to inspect, auscultate, and then palpate the 4 quadrants and listen to bowel sounds. So the abdomen looks good. The skin is clear, intact. There's no breakdown. I'm going to go ahead and listen to the bowel sounds in all 4 quadrants. Bowel sounds seem normal. I'm going to go ahead and just press on your abdomen. Let me know if you feel any tenderness. Do you have any pain, or do you feel tenderness where I'm palpating? Okay. Now I'm going to go ahead and move down to your lower extremities, which will be your legs. So just like your upper range of motion, I'm going to do lower range of motion. So can you please push against me? Okay, now push towards me. All right, let's go ahead and bend your knee. Let's bend the other one. Perfect. I'm going to check for the popliteal poles behind the knee and also the dorsal poles. I'm going to do turgor and check for capillary refill. So patient has strong lower strength. Skin is intact. There's no breakdown, and it's warm to touch. Now I'm going to go ahead and ask you to please turn to your right. I'm going to check the back of your head for any bumps down your spine. Skin in the back is also intact. Now I'm going to go ahead and listen to breath sounds. Perfect. Breath sounds sound clear. You can go ahead and sit back. Okay, now I have to ask this to every patient that comes to the hospital. Do you feel, or have you ever felt like hurting yourself or someone else? No. Okay. Have you had a fall in the last month? How about in the last 3 months? Okay. Now, do you feel safe in your current home situation? You do. Okay, awesome. So I'm going to go ahead and document all of this and let the doctor know of today's assessment. And do you have any other questions for me? Perfect. Awesome. So you have a great day, and I'll be back to check on you in about 15, 20 minutes. Okay? Thank you.